So here we have Jessie. We're going to perform a general examination of Jessie's skin in a methodical manner, starting at her nose and working our way back towards her tail. Around the eyes, look for signs of excessive discharge or inflammation. Sometimes you can actually pull down the lids and look at the tissue under the eyelid. This should be a very pale pink colour. Check the entrances to ear canals as well. There shouldn't be excessive discharge at the entrance to the ear canals, and the inner aspect of the ear flaps should be smooth. What we do now is run our hands over her coat and part this to look at her skin. The skin should be a pale colour in most cats, very pale, almost grey. You might see little bits of pepper-like dusty material, which is dandruff. And pay particular attention to any white areas for bits of dark brown or black debris, which could signify flea dirt. The body should be mostly covered in fur. Some pets will lick themselves excessively if they're very itchy and may remove the fur, causing baldness or alopecia. I'm just going to check around Jessie's bottom. Again, this should be mostly covered in fur. Some cats will lick excessively around the back legs and bottom if they have fleas or allergies. Now we have Megan, and similar to Jessie, we're going to start by looking around her mouth. You might notice a staining of the fur under her lip. This can be quite normal, particularly in spaniels. If, however, the skin is reddened or inflamed, do seek veterinary attention. The skin surface of the ears should be pale and smooth. Normally, ears will clean themselves of wax and debris, so a small amount of wax at the ear entrance is normal. What you shouldn't see are ear canals where inflammation and skin overgrowth has caused a blockage at the entrance. Make sure you check pads and the claws of your pet. Try to open up the web between the pads and look at the skin colour. This should not be inflamed. Now with Megan lying on her back, you can see she clearly enjoys this, and we can easily see her tummy. We can also now examine the skin on her belly.